that I'm opening the first dry eye center in the Metaverse. We're gonna have an educational center where we just start talking about dry eye or eye health as something that we do as a regular part of our daily care of our bodies. There's 4 things that we do to protect our teeth every day. We brush, floss, toothbrush, toothpaste, floss, and mouthwash, right? Yet they don't know even one thing that they could be doing for their eyes on a daily basis to protect their eye health and their vision. And so that's a lot of what we're going to be talking about in the Metaverse is some eye education straight to the public, encouraging them to have eye exams in person at their local eye doctor. Amazing how all the technologies can come together.
Hey Eyes and Shine, and welcome to the I Give a Damn podcast, brought to you by Fluorescene Media, the same company behind ODs on Facebook. Today we are joined by our special guest, Dr. Pam Theriot. Dr. Theriot is a dry eye specialist and a self-published author of the book Alleviate Dry Eyes. Today, we get to hear about her path to her passion in the world of dry eye, along with how she manages dry eye disease in her own clinical practice, as well as a special project she's working on, bringing dry eyes to the Metaverse. So, please click those like and subscribe buttons and tune in to this conversation with Dr. Pam Theriot. Well, Pam, thank you so much for joining me here on the podcast, taking some time out of your day. I know you're very busy here at Academy with presentations and meetings and all over the place. But thank you. This is always a huge honor to meet another very passionate person in our profession.
Well, thanks for having me today. I appreciate it.
With just like the beginning of all of their podcasts, one of the best questions I love, and it really gives me a good insight, is how did you find optometry? Because, right, it's a very special profession, and everybody's got a unique story for it. How did you find optometry in the first place?
Well, I've wanted to be an optometrist since I was 12 years old. And so actually, sometimes when I think about it, it almost makes me tear up a little bit. But I remember being 12 and getting my first pair of glasses, and my mom driving me home from the optometrist after picking them up. And I got out of the car, and I'm standing in my front yard, and I looked at the trees and thought, wow, they have leaves. I can see the individual leaves. And then in my 12-year-old brain, which is kind of weird, thought to myself, what an amazing thing to do to be able to provide that to somebody every day as a profession. So I had like this aha moment about my eye doctor, and then that I wanted to do that for other people.
And that's a great, fantastic story. And I hear a lot of people use that same thing. They're like, I never knew trees had leaves.
It's so silly, but
because otherwise it's just a big blotch, right?
Of green, yeah.
How went through optometry school? How did you end up like finding where you're at now? Because I understand you've traveled quite a bit in your career.
Yes. Yeah. So my husband was in the military. He's retired now, actually just a handful of months.
Well, congrats to him, right?
Right. So we moved around a lot. Every 2 to 3 years, typically, we would move. And so I'd have to start a new job and a new state and a new town. And it just seemed that the easiest way to find a job when I would go to a new town was I was always with an ophthalmologist. They were more hiring of optometrists than optometrists were. And so I ended up practicing with several ophthalmologists, and really that's what started my passion for dry eye. So maybe when we were stationed in Albuquerque, New Mexico, I started suffering from dry eye. So there I was, like maybe 30 years old about that, and I couldn't wear my contact lenses all day. I felt like my makeup would start to run down my face halfway through the day, and so I really...
Just from reflex tearing, right?
Yeah, and just really uncomfortable with my contact lenses, and I felt like the dentist with bad teeth or the eye doctor with bad eyes, and there I was trying to tell patients that they should wear contact lenses when I couldn't wear them myself. And then as we started working... The next place I started working with an ophthalmologist, and it just kind of ended up in my chair more than in the ophthalmologist chair. And I really got a passion for it and started diving into specifically ways that I could treat those types of patients.
With moving to, like you said, it was New Mexico, right?
New Mexico.
So what do you think it was? Probably the humidity, the dry desert air that really triggered it for you, or what?
I think so. That being maybe the first part of it.
That was the straw that broke the camel's back, right? There was probably many things going on at once.
Because there I was female, about 30-ish. So, but yeah, just I think the lack of humidity. Mm-hmm. And then we ended up moving to even drier places after that. We moved to Tucson, Arizona, which is even more dry than New Mexico. And the dryness just got worse and worse.
Now, with all of the moving, you eventually kind of settled down. And now you've kind of led and built a whole dry eye center, correct?
Yes.
How did that go about? What
so
was it like?
So I just decided that at some point that dry eye was my passion and that I wanted to really focus on it. And so I started following other people. Actually, I was just talking about this today at lunch about how Art Epstein was someone that I really reached out to, and I went to his clinic. For a while, I lived in Tucson. He was in Phoenix. And so I was able to go see his clinic, spent the day with him. So I really looked out for mentors who could teach me more about dry eye. Another shout out to Josh Johnston. He's in Atlanta. I spent a day with him. And then really traveling the country, going to Dry Eye University, any dry eye conference. Doug DeVries and Paul Karpecki, just trying to really dive in on these experts. What did they know and what could I learn from them? So I really put a lot of effort into that, of learning all there was to learn about dry eye. Since when I was in school, there was maybe 2 pages in the textbook about it, right?
And it's always changing, advancing. There's always little things kind of coming out. So right now, dry eye has been your passion. You've been working on that. Do you work in the clinic all week long, 3 days a week, 5 days a week?
5 days a week, yeah. I'm full-time. Currently, I work at Lesk Eye Specialists in Shreveport, Louisiana. We are a cornea cataract refractive office, mostly. So I work hand in hand with a surgeon and do dry eye treatments to prepare patients for surgery, and then after surgery. And then the glaucoma guy sends me.
Right. Because I was just speaking with a few other people about the relationship between glaucoma and all the anterior seg issues related to either medication use, possibly from secondary to any sort of post-surgical cases, and they definitely kind of go hand in hand in some ways.
Right. And ironically, another resource referral source that I get patients from is the retina guy down the street. I don't know that they realize all those injections that they are giving to the patients are causing their corneal nerves to decrease. And so we treat a bit of neurotrophic keratitis, or even some severe dry eye. Since I actually have been at this practice now 7 years, thanks to COVID, we didn't get moved that last time before my husband retired. Oh, no. So that was one silver lining. We got to stay where we were. And so I've been at this practice a while now, and so definitely getting some referral basis, just nice.
I'm curious because you've had not just been working in this clinic and building this dry eye center, you've done a lot of other special projects, including writing a book on dry eye, and I believe it was published in 2018, correct?
18, yeah.
Was this something that you self-published? Is this something that you worked with a team on? Tell us a little bit more of that story, because I don't know too many people that have written a book on a subject in eye care.
Right. So 2015 is the latter part of 2015 was when we moved to Shreveport, which has been our final military move. And I was really heartbroken about leaving the patients that I had, the practice that I had been at before. I really thought was just such a great practice. And I was very distraught about moving this last time that we did. And I thought, wouldn't it be great if I could just treat patients regardless of their zip code? What if I could just take those patients along with me? And so it kind of got me on the idea of, first I wanted to blog, but that whole computer, trying to set up a website and start a blog, it seemed overwhelming at the time in 2015. So one day I was having lunch with my Shire MSL, this is dating it for sure, and she said to me, you should write a book. And I said, I could do that. Like immediately. I don't know how I had this confidence that I could just write a book. And I was like, well, I know so many things about dry eye. I could just write a book. So I took an online course about how to self-publish, which is what I did. So the whole book is just me, just my thoughts, just my ideas. But from the research that I had done, all of these mentors that I had gone to see, all of this knowledge, and just kind of put it all together. But the premise of the book is how can you treat dry eye without going to the eye doctor? It's just using lifestyle changes and a simple set of 4 daily hygiene techniques that I call 4 simple steps. And so that's how the book starts, and then it kind of dives into your diet, adding omegas, getting better hydration, better sleep, taking out your contact lenses, how to care for your contact lenses, how to properly care for your makeup routine, and then it dives into your environment, so indoor environment, humidity, outdoor environment, pollen and such.
Which is a huge topic of discussion, I think, is easily missed in kind of a typical dry eye center of care, right? We're so focused on medications and in-office procedures and things like that I think a lot of practitioners just either don't have the time, or they overlook, or just don't have the luxury of really having that in-depth of a discussion. Because it sounds like from kind of a holistic approach, like that's the fundamental sort of things that almost all patients should be trying to change in their life. Well, before they even start rolling down this hill of kind of recovery or emergency treatments in a way.
Yeah. So actually in the TFOS DO's 2, the step 1 is exactly what I just talked about: lifestyle accommodations, and then artificial tears, warm compresses, lid scrubs, omega-3 fatty acid supplementation. And so that's, step 1 of how do we treat dry eye patients, whether they're mild, moderate, or severe. It's kind of the way that I explain it to patients. And the other about, writing a book is that I don't care who you are in practice and what your passion is. You don't have time to explain to people all of the things, right? So having the book as a reference, or some YouTube videos, or some other things that patients could be doing outside of the clinic to inform them.
What was like, of course, like you said, writing a book, I could do this. It's something I think all of us have the potential to do, but it sounds like, at least from your voice, it's more challenging than simply like, let me just sit down for an hour, punch this thing out. It's a lot more challenging than that. What or perhaps it wasn't for you. Do you find yourself naturally gifted at writing, or what kind of challenges did you face in that process?
So I would say hallelujah to editors, because my editor honestly made that book the way that it is. Like, she really cleaned it up, because maybe as clinicians, we have all these thoughts, and it was kind of scrambled.
Scatterbrained,
yes.
I'm that way too.
So she really helped me to categorize things better and put all of the things all together so that it came out more cohesive. But I don't know that I could have done that myself. And, taking somebody from the outside where it didn't all make sense to her, and we needed to put it together in different ways so that it did. So
they say teamwork makes the dream work, right?
For sure.
With just kind of, again, unfortunately, I think a lot of clinics do miss that first step in kind of the TFOS sort of recommendations for just lifestyle and those sort of changes. How do you incorporate your knowledge, expertise, this even the knowledge you have in your book, in your typical clinical practice?
So I actually send patients an email sequence. So when they come to the dry eye clinic, or if they schedule an appointment, I have about 2 emails that go out before they come in, just to tell them like what to expect. And I email them like a speed questionnaire so that they can have that information before they get here, and just kind of walk them through like what's going to happen at the dry eye exam. Sometimes they're apprehensive, right? They're going to come and see some specialist, right? And so they get real apprehensive. So just, tell them exactly what to bring, exactly what to expect. And then once they come, like I said, those 4 simple steps I prescribe to all of my patients, mild, moderate, or severe. you're going to learn about that and use that daily hygiene to support your ocular health. So then after the appointment, they get a series of videos that go over how to do those 4 simple steps. And then I send them one about, these are some possible medications that we might try. So they have all of the medications kind of in front of them. These are some of the in-office procedures that we might consider, so that by the time they come back to me, whatever I've set their return at 6 or 8 weeks or 12 weeks, depending on what I did start them on, they already think that they know me, right? Because I put one little personal nugget in each of the emails, like, oh, by the way, my favorite vegetable is the eggplant. Just like something funny about me. And so when they come in, like often it's the second time I've ever seen them in person, and they come in hugging me and really feeling like they know me. So
that's definitely I consider it a pro of being involved in things like social media, making content directly for patients. I think of it as a pro. But there is also, the parasocial relationship is the term for it. And it can kind of be a double-edged sword. It's great for that reason because people do bond with you. They understand you. They feel like they know you. I feel like compliance is better, and or compliance or adherence is better. Mainly because patients finally understand more what's going on, and they feel like somebody else gets it, and they can really hear what you're saying. The downside to it is, especially in the social media world, some people, I've only had 2 stalkers myself, but thankfully nothing dangerous. But there's sometimes people who get like kind of obsessed with their doctor, even without social media presence. But there's always that.
Yeah. Or when someone comes in and is like, oh, you're famous. That's why I want to see you. And you're like, oh, well, I'm just me.
Yeah.
Right?
I'm curious about the 4 steps. Can you walk us through just those general 4 steps? I'm sure we're all aware of it in some regard, but I'd love to hear it directly from you.
Yeah, so I do 4 simple steps from the TFOS Dues 2, step 1. And so I named them all 4 H's. So the first one is hydrate. And sometimes I talk about that in terms of artificial tears. Sometimes I talk about it in increasing your water intake, and now we have the dry eye drink, so just getting hyper hydrated. So first, step 1 is hydration. Step 2 is harmonize, and that is cleansing the lids and lashes and backing off the overgrowth of biofilm, whether it be bacteria or mites, is getting that biofilm back under control so you don't have that overgrowth. Step 3 is heat, so a mask of some sort, whether it's electric or microwavable or instant now. And then step 4 is heal, which is a supportive omega supplement. So something that's going to give your body the building blocks they need to make healthy tears.
I know the omegas, I've found success personally with omegas. I know there's still a debate within the profession around it in some degree. Do you have any personal thoughts from either just your own personal experience or from just what you've read in the literature? Like what do you find seems to be some of the best success you've seen with omegas? Yeah,
so I do recommend a nutritional supplement that contains omega fatty acids. And I go with ones that have research for the eye, right? So typically we use PRN or Hydro Eye. And I've recently started using one called Itamins that is vegetarian, and it's highly omega-7. What is that? C. buckthorn?
Correct, yes.
Yeah.
I've spoken a few times with the ophthalmologist who started
Dr.
kind of finding on that. I wouldn't know how to say it correctly.
Yeah.
But perhaps someday we'll be able to have him on as a guest. But with omega-3s, and then like you said, science-based health, I think, is a little bit on a specific type of omega-6. And we don't have to get too big into the weeds about it. But I know there's definitely a lot of it's muddy. I like to say it's a muddy research because there's so much research out there and nobody uses the same concentration or the same exact formula, or perhaps they didn't even monitor or track the same things, and so it's challenging to give us like a dead solid answer.
Yeah, cut and dry. I do think that it's still most dry eye practitioners do advocate for omegas for their patients, and so I keep it in my regimen. It's such a simple thing to do, as well, to take a supplement, and there's good ones out there, and I do recommend specific brands, like I just said, instead of go to CVS and get it.
Do you ever advocate for patients to do like a blood test for omega-3s?
Yeah, I've thought about that Omega Quant.
That's
I think
one of
it's
them,
just a finger prick kind of thing, so it would be easy to measure it.
That's one thing that I've considered starting to do, because I've tried it myself, is to at least talk with patients, like, if you're taking it, because they might be taking one, but it's like, do you really know where you're at? Are you taking enough? Because they might be taking one that just isn't
absorbable.
Yeah, it might be they're not absorbing it. Maybe they're not taking enough. Maybe it's that's not the highest quality for them, so they're not quite getting the same amount that they think they are. So that's something I've personally considered. Now, with just the realm of dry eye and kind of starting at that playing field, what beyond just your book and what you recommend, are some of your other favorite dry eye treatments that you're really either fascinated by right now or you find really good success with?
So recently, in this year in January, we got intense pulse light in my clinic, and I think that plus mybography, which we had a little bit longer, mybography, like looking at those meibomian glands, is eye-opening because you can see the structure, and it gives you a sense of urgency when you see some of those glands that you really need to treat it right away. So for a while I had mybography and lipoflow, and so we were doing that. And then now I have an intense pulse light, and so I'm doing a lot of intense pulse light still. Not great for all of my patients because it's not good on all skin tones.
Correct.
Right. So still doing a ton of mechanical expressions. Yeah.
Do you use that like when you do IPL? There's some doctors who advocate for doing an expression right after an IPL session. Are you doing expression just on its own, or do you have the patient go through a heat treatment in the office of any kind before?
So when I do a session of IPL, I express immediately after. And some of those patients, I'm still having them do a lipoflow or a tear care during their IPL sessions. But I would say that 40 to maybe even 50% of my patient population isn't a candidate for IPL because of their skin tone. And so I still do a lot of mechanical heat expressions.
How about meibomian gland probing?
I have never done that.
Yeah, I haven't either. I've talked with a few other professionals who believe in it and find that it has good success. It's something that I personally need to research more and perhaps even invest in a proper probing tool just so I can start to offer it for patients that I feel like would maybe benefit from it.
Yeah.
What about other kind of future treatments that you think right now you're either reading in the research or hearing about here at things like Academy that kind of excite you and make you happy about looking forward in the future of dry eye?
So I think there's several drugs that are on the horizon that are going to help us make more tears, help our pain sensors in our eyes, our nerve endings. So I treat a lot of neurotrophic keratitis, but I don't have a real good treatment for neuropathic corneal pain.
Sure.
I think that is something that's coming. Device-wise, I'm really look a lot at patients' eyelids all day, right? So we're having them look down. We're looking for blepharitis. I'm looking at lid seal because there's so much of this dry eye that's like, I'm doing all the things and yet they're still dry, and then you test their cornea, poke. Oh no, it's not neurotrophic. Oh, it's that they don't even close their eyes when they sleep at night, right? And so you're missing some of it. So I'm looking forward to these, perhaps with radio frequency or radio frequency plus microneedling, that will be able to do non-surgical lid procedures as optometrists. So I can tighten my patients' lids. As I said, I work now in a surgical practice, so my patients are typically over 50. More so than the other way. So a lot of lid laxity that, is just the way we age, but it would be nice to preserve that as long as we can.
Not specifically floppy eyelid syndrome, but
No.
definitely some lid laxity and poor lid closure in the evenings.
Exactly. Yeah.
It's always kind of surprising to me because my frustration with dry eye within our industry is that dry eye is a diagnosis. It's funny enough, it's still dry eye syndrome in ICD-10 when it's truly a disease now. But the fact that it is such a big catch-all.
Broad,
yeah,
yes.
It's so broad when there's so many other things going on. It's almost never just one thing. It's a combination of multiple things going on, whether it be poor blink rate, poor blink amplitude, if they have... they sleep with their eyes open. They also have allergies. They've got other systemic diseases going on. It's like a whole accumulation of things.
Yes. And then they all come together and muddy the waters, right? For sure.
With kind of going forward, because again, you've done all these other projects, you've written this book. I hear you're kind of working on this next kind of project that may really take us into this next age of technology. And you're kind of pioneering that in the dry eye space. Can you tell us a little bit about that?
Yeah, so I'm super excited about this project that I'm opening the first dry eye center in the Metaverse. And so what does that mean? Is that we're going to have an educational center where we just start talking about dry eye or eye health as something that we do as a regular part of our daily care of our bodies. There's 4 things that we do to protect our teeth every day. We brush, floss, toothbrush, toothpaste, floss, and mouthwash, right? So you've got 4 things that you do for your teeth every day. And most Americans would say that they do those things every single day. They wouldn't dream of skipping.
Or they at least learned about it, right? They've been told by their parents, they've been told by other people they should be doing these things.
Exactly. Yet they don't know even one thing that they could be doing for their eyes on a daily basis to protect their eye health and their vision. And so that's a lot of what we're going to be talking about in the Metaverse is some eye education straight to the public, and encouraging them to have eye exams in person at their local eye doctor, and just educating themselves on a lot of some of it's going to be about beauty as well, about the toxins in eye makeup, the importance of removing your eye makeup at the end of the day. So kind of.
And there's a lot we just don't know in that space, especially here in the U.S. versus other countries, right? There's different limitations in like Europe versus what products are available here in the United States. So I think that is going to be a big topic of discussion for a lot of people, just understanding what are we using and what are we putting on our face and
what risks do those products have, right?
So I think a big question that almost everyone will have whenever they hear the word metaverse, it's still so early, young, and people still aren't sure how to conceptually visualize that. Exactly how do you envision people are going to be accessing this information? Is it through VR headsets? Are they going to be on their computer, on their phone? How is this going to work?
Yeah, so I think either phone or computer, and you could just go and browse through the Oasis Dry Eye Center is what we're calling it. You could go there just as you're sitting at your desk on your computer or looking at your phone, or you could build yourself an avatar and your avatar could go and walk around in the space, which is really super fun. And there's going to be a lot of like hands-on where your avatar could pick something up and say, oh, well, what does a warm compress do? And oh, okay, you can put the compress on your avatar. You could go through and decide which eye makeup remover you might want to try, and do the ingredients agree with me, and those kinds of things. So it's going to be really expanding over time.
Right, because it's just the beginning of this, and we have huge companies such as Meta, literally Metaverse, right? That's kind of how they rebrand it. Facebook rebranded in that direction.
Yes.
But not just them, but all the other big tech industries are looking at this and knowing that it will be something in the future. So it's great that you're kind of pioneering that space, and all for public education, which I'm all about.
Right. Yeah. So patients could go in there as an eye doctor. You could go in there and educate yourself. Pick up a product and watch a video about it, and just explore what there is to see in the dry eye treatments.
Right. And potentially somebody could even purchase like over-the-counter products through that sort of a medium, right?
Exactly.
So they could see they could see like a wall of like 12 different types of warm compresses, because there's a lot out there.
Right.
But they could kind of pick one up, see what it would look like virtually, but also see educational video, and then being able to basically say, okay, I'm going to get this one for $29.99, and then it ends up getting shipped to their home within 2 days later.
Right. Yeah. So really amazing how all the technologies can come together.
It's amazing. I think the way that could go forward that'd be really useful is to bring in like guest speakers on dry eye to talk about all these different subjects, so they can get like education from these other doctors, and then even potentially see that, okay, hey, well, they're only like 2 hours away from me, maybe I should go see this person.
Yeah, so there'll be some my dream goal is to have like a theme every month in the center, and so talk about whatever that theme is, whether it's like computer vision one month, and then cosmetics another month, and omega-3s another month, and have experts like our colleagues come and give a lecture. And then there'll also be like a doctor locator, so that say you go in and you pick up a tear care and you're like, oh, this is really cool, I think I'd like this, and then you could hit the button and say, put in your zip code and find a doctor locator, somebody in your area who has tear care. So those are the fun ways that technology can be so helpful to our patients.
Right. And it's just kind of the beginning, like you said. You guys are just starting this project, and is it available even right now? Is it something someone could access?
By the end of 2023.
Okay. So
Yes,
it's
imminent.
It's coming soon.
Yes.
And how do and we'll put it in the show notes, but how does somebody even begin to access or look this up?
So you could go to omniverse.city/oasis, and that's Oasis with an I.
Okay, so we'll see if we can put that in the show notes for people who are watching. I'm curious, just because on the realm of the metaverse, did you ever read the book or see the movie Ready Player One? Did you ever see that one? Steven Spielberg, I believe, directed a movie of it maybe 10 years ago, but it's based on a book. But funny enough, it's about like a very futuristic, somewhat within the realm of, it seems like reality could get that direction of people going into a metaverse, basically a giant living video game, kind of like plugging into the Matrix in a way. Mm-hmm. But funny enough, it's called The Oasis in that book in the movie. Yeah.
That is cool.
You guys picked a good name for that.
Yeah. It was somebody on the team that picked it, actually. So it wasn't me. It was like, oh, it would be like a really moisture, it'd be a lot of trees, it'd be like an oasis. And I was like, oh, oasis.
Perfect.
Yeah.
There we go. Well, one of the big questions I love to ask all of our guests now, because it just puts a good frame of what you really care about, what you really either love in our profession or what you would like to see improved, is if you were waking up the next day, if you were elected as the kind of Surgeon General of optometry, and you could kind of focus your mission or snap your fingers and make a change for the better, whether it be for our industry or for healthcare in general, what would you do?
So I would promote that eye care should be part of your daily routine care, for sure. I think that so many things could be prevented if we were concentrating more on our eyes instead of ignoring them until there's a problem. And so I think so many other healthcare, maybe not so many, but the dentistry has done that so well that we just know at the age of 1, you should already have had a dental exam. 1 tooth means go to the dentist, and that you should see the dentist twice a year. And so I would really want to make public awareness more of that ocular hygiene is important.
Right, and there's skincare routines, online everybody has dermatology recommends this skincare routine or these products, and so starting to get that a little bit earlier in people's minds of how important it is to take care of the eyes,
especially since we're moving so much more to devices, to digital. It's going to play a bigger role as technology moves along. Patients just don't know what to do when their eyes hurt after they've been on screens. Is there something that they can do? Are there some simple steps that they could take? So,
and some people aren't even like aware of it, really. You know, you ask them like, how are your eyes feeling? Fine. They don't. Yeah.
I feel fine.
As they're rubbing
Too many
it.
drops.
Yeah. Exactly. So, well, Pam, thank you again for being a guest here on the show. I really appreciate you spending the time. Hope you have an amazing rest of your academy here in New Orleans. And hopefully we'll be able to have you on again some other time, talk more about dry eye and what other special projects you're working on.
Awesome. Thank you so much, Dr. Allen. I really appreciate being here.
So that was our episode for today. Thank you so much for tuning in. If you did find value in this episode and like to hear more, make sure to subscribe to us either on YouTube or follow us on wherever you get your podcasts from. Otherwise, I appreciate you guys listening in and hope you have a fantastic